Hello, my name is Marc Laniado. I'm a consultant urologist. I specialise in helping men who have prostate problems, prostate cancer and prostate enlargement. I work in London and in East Berkshire. I'm an NHS consultant at Frimley Health Foundation Trust, and I work in private hospitals in the centre of London and in Windsor. I help men who have prostate problems return back to their normal condition. That is my specialty. Prostate cancer is diagnosed based on a combination of symptoms, blood tests and scans. Typically, a man may have some urinary symptoms such as getting up at night or passing urine more frequently. He may then see his GP, who will often examine the prostate or maybe not, and sometimes send a blood sample off for a test called PSA. If the PSA exceeds a threshold, which is thought to be abnormal, he may then refer that patient on to a consultant who will usually examine the prostate and then ask for a multi-parametric MRI. If that MRI scan is abnormal, he may then suggest that patient have a biopsy. And when a biopsy is taken, tissue is looked at under a microscope, and that can show if prostate cancer is present or not. Prostate cancer is more common as men get older. It's very rare in men less than 40, but becomes more common as men get aged more than 50 years. In fact, it's most common in men aged between 70 and 73 years. Men who have a family history of prostate cancer, such as a brother, a father or a son, are also much more likely to have prostate cancer. Similarly, if you're Black, British, or you're from Africa or the Caribbean, you're much more likely to have prostate cancer than a white person. Asian men, paradoxically, are much less likely to have prostate cancer than the other groups. Other cancers are also relevant. If you have a family relative who has had breast, ovarian, pancreatic or bowel cancer, you're also more likely to have prostate cancer. That's because there are some genes which predispose to all of these conditions. Interestingly, men who are obese, that is men who have a body mass index more than 30, are more likely to have advanced prostate cancer than men who are not obese. Black men are more likely to get prostate cancer than white men. In fact, about 1 in 4 black men may develop prostate cancer, and 1 in 12 men may die from prostate cancer. Interestingly, most black men do not realise that they're at greater risk of getting prostate cancer than white men. Ashkenazi Jews, that is Jews who come from Europe rather than Sephardi Jews, are more likely to carry an abnormal form of the gene known as the BRCA gene. The normal form is carried by all of us, but 1 in 400 of us carry an abnormal form of that gene. Ashkenazi Jews have a 10 times greater chance of having that abnormal and dangerous gene. That is, 1 in 40 Ashkenazi Jews carry it. They may not know they have it because they may not have a family history of having prostate or ovarian cancer or indeed breast cancer, but there is a much greater chance. If you carry the BRCA gene abnormality, then your chance of having significant prostate cancer that can kill you is much higher than normal. Hence, Ashkenazi Jews should be offered testing for the BRCA gene abnormality and other genes, in fact, if they have related cancers such as prostate, breast, ovarian or pancreatic. If you have a family history of prostate cancer, first of all, you shouldn't be excessively worried. What you should do is consider early testing. That means having a PSA possibly at age 45 years or even age 40. If you have a PSA test done regularly and it exceeds a threshold, then you should go on to have more tests such as an MRI scan to look for the possibility of prostate cancer. What you can also do is to try and reduce your risk of getting significant prostate cancer. You can achieve that by keeping your weight down, exercising regularly and having a good diet. It's important to avoid things that can increase your risk for prostate cancer, such as eating too much red meat and cheese. A prostate cancer check involves having a blood test for PSA. PSA is a marker for prostate disease. It also involves having an examination of the prostate by placing a finger in the back passage. We also consider your family history and your ethnicity too. If your risk for prostate cancer seems high, then you go on to have an MRI scan of the prostate. If the MRI scan of the prostate shows a significant abnormality, then you may need to have a prostate biopsy. The biopsy will give us tissue for us to tell if prostate cancer is indeed present or not. Prostate cancer can be cured when it's early. Not all prostate cancers need to be cured because not all of them will in fact be threatening to someone's life. But many cancers which are important can be detected early and they can be cured by a variety of different treatments. Some cancers are more advanced and they may need a combination of treatments rather than a single treatment. But for many men, if caught early enough, prostate cancer is indeed curable. Prostate cancer can come back after treatment. If it comes back after focal therapy, often you can retreat it by a second time with focal therapy again. If it returns after surgery, you can usually follow it on by radiotherapy. And if it returns after radiotherapy, sometimes you can have surgery and sometimes you can also have one of the focal therapy techniques. In general, it's easier to tolerate radiotherapy after surgery than surgery after radiotherapy. So if you're thinking about treatment, it's usually best to have surgery first if that's something you would consider, as if you need radiotherapy afterwards, it's a good way to have that treatment sequence.